I'm Ginger Heidel with the Coastal Health District, and tonight I am joined by Dr. Bonzo Reddick, who is the Health Director of the Coastal Health District. And tonight we're going to talk about adult immunizations. A lot of people feel like once you get done with school, then maybe you're done with required vaccines, but that's really not the case. Can you talk to us about some of the adult vaccinations that are really important to consider?
Absolutely. So some of it also depends on if you got all your shots as a child as well. So and also when we say adult, are we saying 18 and up? If that's the case, then for a lot of people who are entering college or military, there are certain shots they need to get done. So that might be things like your meningitis vaccine if you're going off to somewhere where you're going to be living in close quarters with someone else. But even if you're not going to college or military, there's certain vaccines you need on a routine basis, even as an adult. Tetanus shot every 10 years, for example. Every season, during that respiratory virus season, flu, COVID, RSV vaccine for some people. So these are things you need to continue throughout your lifetime.
And another time when people may want to consider vaccines as an adult is if they've got a new baby coming into the family. So parents, grandparents, what are some vaccines that they should consider if they'll be welcoming a new child?
That's very important, especially in today's news. We've had all these measles outbreaks over the country, right? So kids aren't able to be vaccinated against measles until they're 12 months old. So those infants, it's really important for the people around them to be vaccinated for things like measles, mumps, rubella, so they can't pass it on to kids. And same thing with flus as well, flu shots as well. Kids can't get the flu shots for the first 6 months of life. So it's important for people to have flu shots, whooping cough shots, all those kind of things, so they don't pass them on to kids before the kids are able to be vaccinated.
So those adults around them end up being that first line of defense until the kids are at an age where they can get those vaccines.
Absolutely, absolutely.
Gotcha. So another time adults may need to consider vaccinations is as they move into being a senior. What are some vaccinations that someone might consider once they're getting a little older in age?
Sure, and that older in age is relative because I'm close to one of those cutoffs right now. I'm almost 50. So it used to be 65 was elderly, but really when you get about 50, there are certain shots that you should talk to your PCP about whether or not it's important for you to have them. Those are things like your shingles vaccine, your pneumonia vaccine, which a lot of people don't know about. And things like your pneumonia vaccine, you might be eligible for those even if you're younger than 65 or 50 if you have certain underlying medical conditions.
So there are a lot of questions that people may have about these vaccinations, and unfortunately there is a lot of misinformation, whether it's on social media, whether it is there are just lots of places that you can get that information and it may not all be correct. What advice do you give to someone who's trying to decide what's the next step for vaccinations? So
I encourage people, instead of running to the first thing you see online or on the internet or on social media, to really talk to a trusted healthcare professional. Each year in America, they give a poll of who's the most trusted profession in the United States, and nurses have won for like 10 years in a row or something like that. A nurse at your local health department or your local PCP's office or your local PCP is a perfect place to go for information about vaccinations, reliable information about vaccinations.
Yeah, and these are the same people that we trust to help us with sinus infections, with any other of our typical ailments. So these are also the people we want to ask these important questions of.
Absolutely. And in addition to that, all vaccines are not always created equal. So there's certain vaccines that are way, way more effective, like the measles vaccine, for example. Right now, in the midst of an outbreak, if you're around somebody with measles, you have about a 90% chance of catching measles. If you are vaccinated, you have almost no chance of catching measles, and you have close to a 0% chance of dying from it. In the midst of a nationwide outbreak that we're seeing, that's a critical vaccine to get right now, as opposed to things like your tetanus shot, which you should get about every 10 years. So like if you've been 8-9 years since your tetanus vaccine, it's not quite as critical. So for people who are vaccine hesitant, I tell them, talk to your PCP and at least find out what are the things that are most important for you, at least, and get those.
Okay, great. And all of those vaccinations are available at your local county health department, so you can go online to find out more. Thank you so much, Dr. Reddick.
Thank you very much.